Hello, my friends. It is Dr. Darla Logan, and I wanted to share today a little bit of something that came up over the weekend. I had a chance to spend some time with some other health practitioners over the weekend, and the thing that kept coming up during our conversations was the frequency in which we get asked to intervene in an injury, and then we give recommendations. Most of the time we are asked for recommendations on what exercises should I do, how do I prevent this, what can I do to keep this from happening again. Sometimes we give recommendations for follow-up, for further treatment with different practitioners. And the frustration in the group of people came back to that so many injury sufferers, I guess, people who've had injuries, they are looking for a quick fix to that injury, and they're not willing to really put in the foundational work to, one, prevent an injury, or two, to help it heal faster. And so this is sort of a common theme that I'm hearing with practitioners, and I know it's not the first time that I've addressed it on my page. But I wanted to share with you, exactly what are those foundational things? How can I keep myself from being injured? It's one thing to fix an injury. It's another thing to prevent an injury. And we oftentimes, I think, we've bought into I frankly think it's a lie, but we've bought into the idea that, oh, well, you just get injured more because you're older. And I suppose we could flush out some science behind that, because the body is in a constant state of degeneration, and our growth factors oftentimes are impaired as age goes on. Our thymus gland is not as large as it was. We don't have kind of the recovery systems that we had at 45 or 65 that we had when we were 25 or 15. But there's a large part of injury prevention that has to happen on a day-by-day basis, and nobody likes the day-by-day basis. So drinking water, keeping your muscles nice and pliable, keeping your cells working the way that they should, bringing nutrients into them and taking waste away in an adequate level, it is really very well facilitated by increasing your water intake. And people, they'll come into my office many times and say, I drink a lot of water. But when we get right down to how much water they're intaking, it's really a very small fragment of what they really need to be ingesting every day. So that's a super easy fix. Drink more water. I like a gallon a day. That's what I personally drink. That's what I find works really well for me with my activity level, and my patients respond really very well to that, with all of not just their injuries, but their overall health as well. So I'm a big advocate of a gallon of water a day. It does take some working up to, so there's discomfort in increasing your water, and I think that that's one of the big challenges that people will use to not do it. The other thing is moving. If we're sitting at a desk all day in one position, which is usually hunched over, and now that many of us are working from home, we don't have all the ergonomically correct setup that we might have in the office. And so if you're sitting 8 hours a day and you're not moving, and then you sit for an hour in traffic each way, and then you come home and you're too tired to do anything, and so you're sitting on the couch, there's just a lot of immobility and a lot of just stagnation in the body. So getting up and moving goes a really long way to helping to prevent injuries. And in addition to that, moving properly. And I don't want to get too much into that, but if you go to the gym and you pick up a dumbbell and you just throw it around and you're not using proper form, you are definitely at a higher risk of getting an injury. So understanding how the body moves, utilizing a professional that can help you with that. Warm-ups, proper warm-ups for the workout that you're going to do. The little things that you do on your day-to-day activity in your day-to-day life will really go a long way in your overall health, but also in helping to prevent injury and then to repair it and heal it if you do get an injury. So there's water, there's adequate sleep. I hear so many people, they want a badge of honor. Oh, I only slept 2 hours last night. That's not a badge of honor. That's an abuse of your body. Sleep, rest. Your body needs that. That's when you repair. That's when you regenerate. That's when your body does its healing. Don't rob yourself of that. If you're having trouble sleeping, get help with sleeping, because sleeping is so fundamentally important in being able to heal from an injury, but it also does a lot to protect you from getting an injury in the first place. So we've talked about water, we've talked about moving and stretching, we've talked about sleeping. Your digestive system, what you're eating. If you're putting in highly inflammatory foods, lots of sugars, lots of high carbohydrates, then you are creating a stiffness in your body and inflammation in your joints that causes you to not want to move, or it hurts when you do move. So you're aggravating a process. And if you have arthritis, osteoarthritis, and any of the other arthritises that go along with autoimmune diseases, increasing that level of inflammation through the foods that you eat just compounds the situation. So you take a fire and you're pouring a little more gas on it. So be mindful of what you're eating. That doesn't mean you can't have a snack from time to time, or a birthday cake at your celebration, or whatever. But we don't have to go, hardcore, zero sugar 100% of the time, but be mindful about what you're eating and really pay attention to how those things are working in your body. But you're going to have to put in some of the work. So when you go to a practitioner and you just you're not willing to do any mobility work, get any massages, drink an adequate amount of water, eat a reasonable type of food intake, sleep enough, but then you come in with an injury and your expectation is that in one treatment, that injury will just automatically be healed. You have to recognize that the foundation that you're trying to heal with is just an impaired foundation. You wouldn't expect any structure to stand on a poorly built foundation. You wouldn't want to move your family into a house that's sitting on a foundation that isn't good and solid. The walls would fall down around you. So remember that your body works much like that. If you don't have a good foundation, you can't expect for the healing and the health to happen in the time frame that you would like it to. Now, there are a lot of factors that go into that, and I have by far not touched on all of them. But if I could just get people to eat well, drink well, sleep well, move well, we go a really, really long way toward preventing injury as well as healing injury. I would far rather teach you how to prevent your injury and how to keep you out of my office than to have you come in and spend a bunch of money so that I can repair your injury. It does have to happen sometimes, and I'm so grateful to have a ton of tools to be able to do that. But don't forget the little things that you do every day, that it makes a big difference. And one of my coaches just recently said, small hinges swing big doors. So I'm going to leave you with that. Don't forget, small hinges swing big doors. What you're doing every day will dictate how well your body will recover if you do get an injury, and goes a long way to preventing those injuries. Until we talk again, Dr. Darla, just if you found this valuable, give me a like, a comment, or a share. I would definitely appreciate it, and we'll talk to you soon. Bye-bye.